Care Classification System, which I will call CCC. As the developer of the CCC with colleagues at Georgetown University, I am presenting this first video entitled An Overview of the CCC System version 2.5, which is updated in 2012. The CCC is the first national nursing standard approved in 2007 and 8 by the Secretary of HHS for coding and documenting nursing practice in the electronic health record. The CCC supports the electronic capture of discrete coded patient care data for documenting the essence of care and for measuring the relationship of nursing care to patient outcomes. The CCC was empirically developed from a federally funded national research study conducted to develop a computerized classification system to predict patient resource needs and evaluate their outcomes. From the beginning, the goal was to develop a classification for the electronic health record. Live patient care data were collected from almost 9,000 patient records from over 600 healthcare facilities across the country. The research team, using both keyword sorts and statistical analysis of the data, were able to empirically develop its interrelated terminologies. The CCC of 176 nursing diagnoses, 804 nursing intervention actions, and 528 nursing outcomes. Each terminology is classified by 21 care components to form a single system and designed to code and document and link the diagnoses to the intervention actions to achieve the outcomes. The CCC consists of a 4-level framework which allows data to be aggregated upward as well as parsed downward to atomic level concepts. The first level consists of 4 healthcare patterns: health behavioral, psychological, functional, and physiological. The second level consists of 21 care components, which represent a cluster of data elements that depict the 4 healthcare patterns and are used to classify the nursing terminologies. As you can see, each of the care components is categorized by one of the 4 healthcare patterns. The care components represent a holistic approach to patient care and provides a standardized coded framework for the electronic processing of clinical nursing practice. It also follows the 6 steps of the ANA's nursing process required for professional nursing practice. The third and fourth level consist of the nursing terminologies. The first is the CCC of 176 nursing diagnoses, which was empirically developed from approximately 40,000 nursing diagnoses and or patient problem statements collected from the original research study. A nursing diagnosis is defined by the ANA in 2010 as a clinical judgment about the healthcare consumer's response to actual and potential health conditions or needs. The diagnosis provides the basis for the determination of a plan to achieve the outcomes. Examples of the nursing diagnoses are activity alteration or bowel elimination. Each of the 176 nursing diagnoses can also be combined with one of the 3 outcome qualifiers: improve, stabilize, or deteriorate, to form the 528 expected outcomes or goals of care. For example, the expected outcome for activity alteration can be coded as one of 3 ways: improve, stabilize, or deteriorate activity alteration. Also in level 3 are the CCC of 804 nursing interventions, which were also empirically developed from approximately 80,000 nursing interventions, actions, services, and or activity statements from the patient's data collected from the original research study. They represent 201 core interventions, each of which must be combined with one of 4 action types for documenting care. A nursing intervention is defined as a single nursing action designed to achieve an outcome for a nursing or medical diagnosis for which the nurse is accountable. Examples of core nursing interventions are activity care, bowel care, or infection control. As I indicated, each nursing intervention must be combined with one of four action types. Assess or monitor a patient's condition represents observing the patient. Perform or provide direct care represents hands-on care. Teach or supervise represents the education of the patient or caregiver. And manage or refer represents the activities performed on behalf of the patient or indirect services. However, when each of the 201 core interventions is combined with one of the four action types, a new concept is formed with a new meaning. For example, bladder care, which is a core nursing intervention, when combined with teach, forms teach bladder care, which expands the concept and provides a new and different meaning, as well as gives more specificity to the concept. To continue, the action types are coded using a separate digit so they can be tabulated and analyzed separately for multiple purposes. An example of the core intervention such as bladder care, when combined with each of the four action types, are shown as assess, perform, teach, or manage bladder care. The actual outcome is the last step of the nursing process and used to evaluate and measure the outcomes. As previously stated, each of the 176 nursing diagnoses is combined with one of three qualifiers: improved, stabilized, or deteriorated, to form the 528 actual outcomes representing the results of the care process. It should be noted that each concept in the CCC terminologies is coded using a 5-character alphanumeric code similar to the structure of ICD-10. Generally, the codes are hidden from the nurse user in an EHR, even though I am showing them here in this video. Now let me describe a few key features of the CCC. First, it is categorized as an interface terminology, which means that the terms or words that the nurse sees and uses are common ones used to document patient care. A summary of the 6 nursing processes are comparable to the 6 steps of the ANA's nursing process and are highlighted in this slide. Further, the CCC terminologies not only link to each other, but are also interactive, allowing for feedback, making it possible to review, revise, and update the care process at different points in time. The interactive feature is illustrated in the CCC information model shown in this slide. And lastly, the CCC is interoperable, which means that it can be transferred electronically across EHRs. The CCC can also be automatically mapped to SNOMED CT, a reference terminology which is needed for the electronic transfer of data to another EHR as required by HHS for meaningful use. Because of meaningful use, it is important to know that, as I stated, CCC is interoperable and can be linked and mapped to SNOMED CT and to other electronic systems, as well as processed and used and aggregated for data warehousing. An example of mapping of CCC to SNOMED CT is shown in this slide, with the CCC code and SNOMED code side by side for the CCC diagnoses and intervention actions. Now that I have described the framework, structure, and composition of the CCC, I want to next provide the major uses of it. In nursing practice, it is primarily used to document patient care because it has unique care concepts, links diagnosis to interventions to outcomes, enables evidence-based practice as well as many other uses. In nursing education, it is used to simulate clinical information systems, document plans of care on PDAs, or conduct online teaching, testing, and evaluation of the student's clinical documentation. The screenshot shown in this slide is for the student tracking system, which is available on the website Toolkit File Desk.demo, which is free, downloadable, access database for your use. In nursing research, the CCC concepts are used to search the nursing literature, provide coded care data for research study, and provide relative value units or RVUs for the nursing intervention action types, which, with a time factor, can measure outcomes, workload, resources, and even cost. To summarize, the CCC is the first national nursing terminology standards approved by the Secretary of HHS, collects data elements only once but used many times. Also, it serves as a coded interface or point of care terminology, is interactive as well as interoperable with other EHRs, and it provides data concepts for storage retrieval and for reuse, analysis, and aggregation for data warehousing. And finally, the CCC can be used to track nursing care across time, setting, population groups, or geographic location, and is in the public domain and free with permission. Yes, the CCC system is used to document nursing practice because it supports the electronic capture of discrete patient care data for documenting the essence of care. Note that the second edition of the CCC manual is now available as the CCC System version 2.5 User's Guide for your use, published by Springer in 2012. The user guide can be ordered from the CCC website. This ends the first video on the overview of the CCC system version 2.5, and now you're ready to view the second video entitled The 6 Steps to Develop a Nursing Plan of Care Using the CCC System.